Okay, now. With you today to give you a sense of the power of those stories and what happens when you share them. Here are the problems we solve. This is kind of the straightforward, obvious stuff I suspect everybody already knows. Poor employee healthcare decisions are causing a lot of waste, but that's not because the employees are intentionally trying to make bad decisions, just to be clear. It's just that they're underinformed, they don't know the things that we all know, and when left to their own devices, they're navigating the system in a less than optimal way. Low quality care can lead to bad healthcare outcomes and time out of work, and worse, departure from the job, unsustainability, problems within the family. I think you know the story. And I think critically, programs that promise ROI are either not delivering it, or the thing I hear most often probably is we just don't know. I don't know if that thing I did last year actually really matters or not. I think it does. They sent me an NPS report, it seems like people like it, but what is it really actually doing for my business? So the story of my company, our company, I think can be told in the next two slides that I'm going to show you. And some of you who have been on this journey with us probably have seen this or something like this. I want to set up what you're looking at. This picture is, of course, the United States. Hopefully you're with me so far. But every single dot on this picture represents the average quality of orthopedics in every health services area in the United States where there are at least 3 orthopedists. So basically every major medical market is plotted here. And what we've done is we've turned those points a different color based on the average quality in those markets. So if you're red, not so hot average quality. If you're green, terrific quality. So not a great picture when you look at this unfiltered. What you see is in a large swaths of the country, the average quality of orthopedics is not great. You see the traditional places, the Minneapolis area, the New York area, the San Francisco area, the Seattle area, they all stand out as pretty high average quality. But if you have employees in the rest of this country and they're fending for themselves, you can reasonably expect the quality that they're going to get is going to be nowhere near as good as it should be. But the idea is that if you redirect people to the care that is available in these markets, where using the same network, you just pick amongst the higher quality doctors, the people who empirically demonstrate better outcomes, you can enjoy a high average quality. Because here's the secret about the American healthcare system. We actually are really good at medicine in this country. But we have a lot of doctors who are not recently trained, underinformed, not using evidence-based care. And because those people are kind of polluting the average, your people are generally flowing to a low average quality of care. So this is taking Grand Rounds data and saying, let's redirect within your current network. We're not going to swap out anything here other than just help people find the higher quality doctor. We're going to show you how we do that in a few minutes. And here you can reasonably expect pretty high average quality. There are still some places in the country, and I won't pick on them for fear that people in this room are from those places, but there are a few places where even within orthopedics, your average quality is probably still not going to be high enough. And there we might advocate bigger use of the remote expert opinion, bigger use of travel programs, and we can talk more about that if it's interesting. Sorry I'm doing this, it's just I got to make contact with the computer at the back. There you go. And here's the outcome. So when you pick top quality physicians, the punchline is as follows: 15% lower readmission rates, 20 to 25% lower complication rates, 30 to 40% lower mortality rates, 10 to 30% lower cost per patient. I read each of those because I think there is emphasis in each one of these. By the way, these aren't estimates. This is Grand Rounds Book of Business data. It's incredible. When you just pick the right doctor, you're on a better journey from the start. Too often, we're starting the journey in the wrong place. Okay, just drilling in on this concept one step further. Most of what we know about quality in the United States comes from brand. It comes from the perspective of this hospital is famous and therefore all of their doctors are good. This hospital has a terrible reputation, therefore all their doctors are bad. Nothing can be further from the truth. In fact, even the great brand name hospitals have a lot of nuance. And even when you zoom into a department, so you say, oh gosh, the orthopedics department at Hospital for Special Surgery is fantastic. And just, by the way, they are by and large fantastic. But even within a department like that, there are going to be doctors who are not performing to the right level. Or maybe they're good at knees, but they're not great at hips. And so what we do, and this is what our clients get to work with us on, is we zoom in and we say, even within New York, which is a terrific hospital market generally, although an expensive one, you find physician quality variance in each of these major hospitals. Okay, whoops. So our core service offering, I think the thing that if you know anything about us, you probably already know a little bit about this, is what we call Grand Rounds Beacon. We started with the expert medical opinion. We feel like we do that pretty well. We get patients care within a few days. It's a personalized report that reviews your diagnosis and treatment. We also offer in-person visit consultations where we set the appointment for you. We pick a doctor on your network. We send ahead your medical records. Costco uses both those services. They recently also added in-hospital treatment decision support. This is the lowest utilization of our products, but probably the thing that we get the most kind of fan mail for when we do it, which is somebody's in the hospital, Donna gets a call, or they call us directly. They say, we don't know what to do. There's so much information coming at us. They're asking us to make a call on Dad, and we're just not sure what the right decision is. And we can help there. And we can talk more about these supporting services, our records collection platform. Every case is physician-led at Grand Rounds. We've made a strong philosophical stand that we think that really needs to be the case. So every patient who comes through care at Grand Rounds is assigned a personal staff physician. But that's Grand Rounds Beacon. And, oh, shoot. So, sorry. So these are kind of the results. So you can expect a per expert opinion case savings about $8,900. If you follow any of the other companies in this category, you're likely to see higher numbers than that. And I'm not sure there's actually a really big difference in the kind of ROI per case. Honestly, I think a lot of those other companies do a perfectly good job. What I think is different about our approach is we're actually following that patient for a year. So this isn't an estimate of savings. This is actually a claims-based adjustment. So after a year, we look at what the patient actually spent or didn't spend with us, and that's where you get that number. Same thing on the per office visit, case utilization. One of the things that I think we've really succeeded with, and Donna can tell you more about this, is our utilization. We just get people to use the service. We make it easy. We make it, I don't want to say fun, because I'm not sure anything in healthcare is fun, but we make it something that's really approachable, very low friction, doesn't require a lot of work on behalf of the member, and we bring people back. And most importantly, when people have a good experience at a place like Costco, they tell other people to use it. Okay, I'm going to switch here for a second, if it's okay with everybody, to a bit of a mobile demo, because I want to show you something that we have not showed anybody yet. Therefore, I hope that it works. Sometimes when you do this, it doesn't work, but I hope it does. Okay. Can you switch to the mobile? All right. So I'm going to open up this app. This is not a demonstration of my kid, but he is cute. So thank you for the O's that I heard in the. Okay, so we're going to go into Grand Rounds Doctor Match here. And so this is the kind of first product on our virtual networks platform. This is the ability to take the idea that there is a right doctor out there for you based on your claims, based on your diagnosis, based on your necessary treatment path, and our quality data set. What happens when we marry those two concepts together? So I'm just going to log in. And here I am. I'm in Doctor Match. And I'm going to get started. I'm going to try to find a doctor. I've been experiencing migraines lately. I never really know what's going on. I don't think I've had a really clear idea about what the problem is. And so I'm going to look for a migraines doctor. Now, I'm going to explain a little bit of the magic behind each of these screens, because for those of you who don't know us, this may seem like you don't understand exactly what's happening here. Because Grand Rounds already has my claims data, they know these are conditions that I've been seen for in the past, okay? But in this case, I'm really interested in migraines. I'm not interested in high blood pressure. So I'm going to turn that on, click Next. Now it's going to say, let's find you a great doctor. It knows I'm here in New York, and it's preloaded my plan data. So I could actually switch this to any of my family members, but today I'm going to look for myself. It knows what plan I'm on, and I'm going to say match me. So now it's looking for providers. It's looking for people who are near me, who are specialized in migraine and accept my insurance. So now it's going to show me my matched doctors. These are actually doctors here who practice neurology in New York. And what's interesting is it's going to show me all of the distances. I can see more results here along the bottom if I want. But these guys with the trophies are the people, Grand Rounds, those are those green dots on that map. These are the people among all the neurologists that are nearby that are recommended for migraine. So I'm going to click on this guy. It opens up, shows me where his office is. He happens to practice at Weill Cornell. That sounds pretty good. But interestingly, it's going to show me a bunch of data that as a consumer I've never had before. It's going to show me how long he's been practicing, how often he keeps his patients, how many referrals he gets from other physicians that are in this network. He's treated 5 times more migraine patients. All of this is available in the data that we have. Where he studied, where he trained, what he's board certified in. And then this patient loyalty one is incredible. This is the one when we user test this back in San Francisco. This is the one more people like than anything else. They like seeing that Grand Rounds employees like this guy. And so in a place like Costco, you can imagine if somebody's already had a good experience, now I don't have to rely on just open internet search results and ratings that seem questionable. I know that the people at my company use this person and had a good experience. So I'm going to go ahead and schedule an appointment. I have time on Monday. Let's see, 11 a.m. sounds good. I'm going to click it. And Grand Rounds is going to go schedule that appointment for me. Now, if he's not available at that time, we're going to come back. We're going to find more blocks. Usually I would select a lot of different times. Got it. Okay. So now the appointment has been scheduled. I want to go see Dr. Safdie. It shows me that I can add this to my calendar, but I also can do a couple of interesting things. I can prepare for my appointment. These are some questions that my Grand Rounds team has suggested I ask Dr. Safdie so I can get a better read on my condition. I can read that same biographical information that I had on him, and I can go back home. Now, and this part's cool, I think that's kind of the clinical flow for the patient. But if I want to say, how was my appointment? Because a lot of people are curious, what was that experience? I can go ahead and I can rate my visit. And I thought he was pretty good, but I didn't think he was amazing. I'm going to give him, give him 5 stars. So I submit, and then it asks me right here if I'd like to send a note to my HR representative. You can obviously turn this off or not. But a lot of the things we hear, yeah. I hope my product team is watching this live streaming because there was a question about whether we should include this idea, but a lot of people do like the feedback, and we want to share it with you because when you buy a product like Grand Rounds or many of the other services that are available here at Conference Board, you're doing a real service for your people. You're doing an incredible thing, and I don't know how often you actually get that feedback, and I hope that you will get that feedback. So that's a first look at the Grand Rounds Virtual Network. I hope you enjoyed it. We obviously went fast because I want you to hear Donna's story, and if this is interesting to you, I hope you'll talk to my colleagues here, come up, talk to me, but thank you for watching that. And then switch back to the presentation and turn it over to Donna. Thanks.
So I got to point it back there?
Yeah, you just kind of have to hold it up.
Oops, pardon me. So I'm not going to spend a lot of time on the picture and everything anyway, but I've been at Costco forever, 31 years. Love it. If any of you have ever interacted with me at other conferences, you know I love it. I'm super proud to work there, super proud of the way our company lets us take care of employees. So it's just really great. A little bit about us, we're huge, and we're getting huger and huger and huger. So other than this type of things, I always like to bring in some kind of thing you might not know about Costco. And my one today is that we sell cars. You usually see a car outside of a Costco. It's a super easy buying process. But we ran a promotion in the last quarter of 2015 for GM cars. So October, November, December, you had friends and family pricing, you got a gift card, a bunch of stuff. We sold 70,000 cars. Wow. 70,000 cars at Costco. So it's just, there's no end to the surprises that I find there. And so when you're trying to, we're a company that's recognized for our quality and our value, not low prices. We're recognized for value and quality. We want to partner with partners that have that same philosophy. Our benefits philosophy is that this is just a core value of our company, and it's been this way since the company was founded. It's really simple. We don't have to reinvent ourselves all the time. We've had, 2 CEOs in 30 years. So there's a really nice consistency of how we are able to operate. We feel that if we offer good jobs and good wages and have great benefits, all good things happen. We have super low turnover, which allows us to be able to offer lots of great programs. And I'm preaching to the choir here, this stuff is complicated, but to our employees, we want to give it in a real simple message that they can understand. We are not held to the same types of ROI pressure or finance pressure. We're told instead, take care of the employees, make it work, and then we benefit from that, of course, by having low turnover, really loyal employees that don't, that take very good care of our members. So that all of that is really important to us. We, just like when Sean was talking earlier, we had to find ways to get the waste out of the system. We could not continue to have higher trends and then expect our employees to pick up the lion's share of that cost shifting. We don't have a high deductible plan. We still have a very generous copay plan with small deductibles, very low paycheck deductions for their coverage. We cover part-timers, so that one slide showed that 89% of our folks are eligible for benefits, and of those, 97% enroll in our program. We're definitely a plan of choice if you and a spouse, are both working, and we're okay with that. I mean, it keeps our employees on the jobs. We're good with that. But there was waste, and one of the big areas of waste were where our out-of-network coverage was, or our out-of-network dollars were increasing. And it wasn't a very smart use of the dollars, not for the company and certainly not for the employee. There was a reason that those doctors are not in the network, and in our biggest areas of pain were orthopedics and bariatric surgery. You guys have probably all seen the same things. So we were able to convince our senior leadership that we needed to eliminate out-of-network coverage. We just really, the networks are big, there's plenty to choose from. And again, like Comcast mentioned, they find a way to save money, and you reinvest that back in the plan. And we did the same thing by saying, let's give the employees some help in finding a doctor, because we wanted to be prepared for employees to tell us there aren't any good doctors in the Aetna network, even though we know there are. So we thought, well, if they tell us that, we can say, hey, you know what? We've engaged the services of an independent company who's evaluating the quality of the providers, and they're not contracted with the providers or any of those types of things, totally independent. They will find you a good doctor. And that solved it. I mean, people were so happy to have it. And we were excited to partner with an expert opinion service, because we thought that that's where the big bucks were. And what we have found is that our employees, while there's good utilization in the expert opinion, there's even more utilization in the doctor's visits. And then we thought, it'll only be for specialists. They only need to find a specialist. Yeah, primary care. They're looking for good primary care docs. And so we started changing our thinking a bit and thought, God, if we can get it solved at primary care, nothing but good is going to happen going forward. So we made that change a little over a year ago, had a very robust communication plan, gave the employees almost a year to get used to the idea, gave them lots of notice. They would get a letter every time they used an out-of-network doctor, just to say, hey, we see you used from Aetna. We see you used an out-of-network doctor. That's okay right now, but as of whatever date, that you're not going to be able to do that anymore, or you're not going to get coverage for it. And then about 3 months before it took effect, we started sending letters to the highest volume providers to say, hey, we want you to know, our employee, your patient, is having a change to their benefit plan, and unless you join the network, they will no longer get coverage for your services. So very, very little noise. It worked out really great. Some of the reasons that we chose Ground Rounds is from when we first started talking to them, they were talking all about engagement and how they were certain that their model could guarantee about 3 times the engagement, no, about 10 times the engagement of the competitors. And we'd be happy with 5 times. I mean, it didn't have to be 10, but engagement was an issue, right? We spend a lot of money on these programs. We want people to use them. And we liked the way they were doing the physician referrals. So they'd taken the work away from the patient to say, hey, you need a doctor for this, or you're telling me you need a doctor for this. Let us help you. We're going to go collect all your records, and we're going to really match you up with the best one for you. And not only that, we're going to make the appointment, and we're going to help you do that. I have called on them so many times for employee issues that have come forward, or you've got even if it starts to become like a disciplinary issue, because somebody's missing a lot of work and they're saying it's because of their health, it's like, hey, would you be interested in seeing a new doctor, or want to take a look at this? Because boy, we sure know that being out of work is hard on you. And they take us up on it. They find a doctor. We get all kinds of thanks in return for it. We also like the way they've set it up clinically. if you call, you talk to a care manager first to assemble all your things, but you have a staff physician there that is really at your beck and call, for lack of a better term, to help you through the process. Orthopedics is something that we know that we've got a lot of area to improve. From a quality, if it's true, like these are our stats. So 76% of the spend is spent in 5 different procedures, but where's that slide I want? If this is true, and this is our data, 63% of the people that interacted with grand rounds changed their treatment, either the treatment or diagnosis. That is a huge impact. If we can get all of our orthopedics going through this, I mean, talk about a huge savings in money and quality and somebody getting back to work sooner and all those things. So we think that, while it took us a year to get our employees ready to move to having no out-of-network coverage, we'll have to have the same kind of patience to change our plan to say you must connect with grand rounds before any orthopedic procedure, or maybe a few of the procedures. And we'll get there. I think we'll probably be there a year or two. Let me see if I missed anything really important here. It just shows musculoskeletal, I'm sure with most of you, it's just a big spend for employers, or for employee plans. And you can see here, I can't see it completely,
just a breakdown
of what's happening. On the musculoskeletal, spine's the big one, and we all have seen how horrible these procedures go when they're not needed and it's not the best option. And that was that. So what again, I talked about this a little bit. We thought expert opinion was where we were going to see the lion's share of the savings in the activity, and if we go back to the beginning and get them in the right doctor from the beginning, that's where we're going to have a lot better outcomes. This is a case study of ours. This gentleman is a dependent, and he had amassed over $300,000 in claims, and continually ill, not really ever getting to the bottom of it, quality of life deteriorating like crazy. Our employee, his wife, was just heartbroken. This is the love of her life. She has this beautiful story to tell about how much this man means to her and how hard it was for her to watch this. And of course, there's one side of the house is like $300,000 in claims. Oh my God, we got to fix it. And then I'm on the side of the house. Oh my God, this poor woman and her husband, and we got to fix this. So we come at it in different ways. But it ended up being, once we got him all figured out with the right doctor, it was a rare allergy in some of his medications that was causing this thing. And the expert saw it within a couple of hours of reviewing the case. He'd been at this for 2 years. So it was, talk about waste. But he's very happy and healthy now, and his wife's very happy, healthy, and productive. So what do I want to say here, Owen? We said that. So our employees have plenty of access to quality physicians. They just need to ask the question and let somebody help them. We are talking about doing a project in New Jersey. We tend to have a lot different treatment patterns in New Jersey compared to the rest of the states, and we think we can get in there and do some, using what Grand Rounds can do for us and our folks at our locations. We think that we can make some big changes there. So we talked about this a little bit. I don't know if any of you have ever experienced the situation of trying to get your medical records collected and getting off to a new provider. It's horrible, right? I mean, you look and there's 18 different ways, and then maybe it comes and maybe it doesn't, and you get to your appointment and they don't have it. These guys get it all collected, they digitize it. So then you've got this digital file forever. I've got one of my coworkers, her husband has a lot of chronic conditions, very ill guy. If she stacks up their medical records, it's a stack about this high. And when they're going to a new provider and she was thumbing through it all to say, I better take this, I better take that, it was a nightmare. So now she's got this digitized way of showing it. She can hand it over. She can share it. You can share it with the provider. They can look at it right online themselves. Makes it really, really simple. So for us, the engagement, we're a population of storytelling. We love to talk about ourselves. We like to talk about all of our personal business. Everybody knows everything that's going on with everyone. I often say to folks, you have the right to privacy. I wish you would exercise it. And but our people love to talk about how much they love working at Costco, how well Costco's taking care of them. And this is how we will continue to promote this type of program. I mean, it is truly the story of I tell two friends, they tell two friends, and so on and so on. The other thing that we've done is we've went across all of our partners and who are competitors, right? I mean, they like to keep their secret sauce secret, and have said, you know, to work with us, you have to start working together, because there's no sense if you're the disability case manager talking to somebody, hearing that they are saying that they can't get a doctor's appointment, and that's why they can't get the medical documentation for their disability, and not having that disability carrier have the empowerment to say, well, let's connect you with Grand Rounds and make sure that we can either find you a doctor that will be more responsive, or let's call Aetna and see if we can't get something out of your claim file to validate that. So we want them to talk to each other. So they're getting a lot of referrals from our partners, but what's really taking off is the referrals from one employee to the next. We have a video. I'm not sure if it's the next slide. It is. It'll tell that story.
It was July 8th, and I walked into my building, and I was completely disoriented. I had difficulty understanding where I was and what I was doing. I progressively was worse. When I would deal with the doctors, I feel like I was one in 1,000, and I was. And that's when I contacted Grand Rounds.
When people have a medical problem, regardless of how serious it may be, they've got questions and they're scared. It's never an easy time, and they're coming to us because they want answers. Grand Rounds is different from every other health benefit out there. Our goal at Grand Rounds is to make sure that no patient feels that they're alone in this. We want them to know that they've got a team who is supporting them, from a care coordinator who is with them all the way to make sure their questions are answered, a record specialist who is getting all of their information collected and organized, our staff physicians who are helping them on the medical side of things, and then our experts who are providing them with their personalized opinion.
When I called, my care coordinator was extremely helpful on the phone. I had a battery of tests, I had spinal taps, MRIs, CAT scans, and blood tests. I released that all my information go to Grand Rounds. I received a 13-page report, and it was easy to read. It was so understandable. That gave me something to hold on to. Grand Rounds is really a pivotal point where I saw hope again.
We know that we're answering their questions, and we know that we're going to give them something of substance at the end of it that's going to have an impact on their life.
They told us that overactive thyroid is the #1 leader of autistic children. Right out the gate, we're thinking maybe we have an autistic child. The special endocrinologist that we were seeing decided to have him try different doses of medication, and it wasn't working. We knew we needed a second opinion.
I had such a great experience and suggested that Jordan contact Grand Rounds.
The level of care from Grand Rounds was way more in-depth compared to the specialists we were seeing. Costco provides awesome benefits. Having the opportunity to get a second opinion so fast was just great. And the future looks really good for him.
I don't know where my recovery would be if I hadn't had Grand Rounds at that time.
So those folks are in Montana, and there wasn't a lot of green dots in Montana, I don't think. Nothing against Montana, but it's rural, and the access, is different. I just got an email today from Stacy. She came and did a presentation at the corporate office this week for one of our employee groups. And it's just this beautifully written email about how proud she was to be able to talk about it in front of the employees, how they had a lot of questions, how she kept reinforcing that, if there's a problem, call the benefit department. We've got a solution. And, Ground Rounds is just one of the many tools in our arsenal. But as a result of her conversation, she had an employee come up and say, oh my gosh, my son was just in this horrible car accident, and he's bipolar, and there's all these problems, and we just don't even know what to do. She goes, I'm going to go call them right now. So it's just that power of talking about it that's been really, it's a key part of how the word gets out at Costco. So I thought, this is an interesting stat. You approach it when you first have a serious illness, and you're just kind of listening and nodding your head as the doctor is talking and having no idea what it is and what it means. But once, Stacy referenced this 17-page report. They're in English. You can read them. You can understand what they're saying. You don't have to be a doctor to know to understand it. So to be able to then walk away and feel that much better about what your case is or what you've got going. I had a brother-in-law who unfortunately passed away this year, who's a Costco employee, and my sister, she called and she said, oh my God, Eric's got pancreatic cancer, where do we start? And I just said, oh my gosh, well, the first thing you do is you call Ground Rounds. Because at least, and even if the news is bad, and the news was bad, how much money did we save on not chasing a bunch of unnecessary care? Because he's a young man, 49 years old. It's, you want to do things, but he was able to get this information and be able to make decisions that made those last few months of his life a lot more comfortable than had he been doing chemotherapy for no reason. And 84% are following the physician recommendation. One of the things that we were worried about when we first went down this path was, were doctors going to be insulted when another doctor told them there was a better way? And I don't know if they are or aren't. It doesn't seem to be that way. It seems, especially if, as Owen mentioned, some of the doctors just might not have, might be in geographies where the treatment patterns haven't changed or haven't updated. It takes a long time to know those. What I've seen more often is that the doctors are appreciative. They're learning something as well, or they're surprised by who the opinion's written by. It's like, how did you get to talk to him? Kind of thing. So it's pretty impressive. So I got to believe there's not a doctor out there that doesn't want to deliver quality care, and having the help to get more information, I think, is just a win-win for everybody. So we saved, $45 million for the added network. We haven't saved $45 million with Ground Rounds yet, I don't think. But we probably will. Yeah. The thing that's interesting about Costco is, if we break even, we're going to call it good because of our culture and our philosophy. But we can't help but have savings on this, and we're committed to it for the long haul. So it fits all of the things that we expect in our programs. It's easy to use. There's these individuals are very caring that are talking to our employees. The value is there, so it aligns really well with what we're after. And I think, is this still me or you? We are really excited about that little demo. When can we have it?
Talk to Ed.
When can we have it?
Very soon.
Yeah, that's, I think any of us that look through the carriers' websites or even some of the transparency tools, it takes a lot of drilling down to find out if we can do it that fast and it kind of has your information in it. That's pretty exciting. So we're certainly ready for that. We'll be interested in narrowing the network even further. I think we've probably all seen this through our time and benefits. It seems like we're having to make more of the decisions for our employees every year. We default them into 401k. We default them into disability coverage if they don't have it. Before you wanted them to have these vast, big networks so that they had choice. Now we found out choice really isn't serving anybody. So I think, by and large, our employees trust us. We have a really trusting environment, but we will probably continue to make more decisions for them because we know what's better, just like mom knows what's better. And I think everybody will be the better because of it. We don't want to be in the space where we're individually contracting with medical systems or providers. That's not our core competency. And so to be able to have this overlay the network that you have is just going to make it a lot easier. That's it. Was there more? So we're happy to entertain questions. Yes.
So the demo that you showed
Yeah.
before, and it had your prior services in there.
Uh-huh.
Sorry, is this even on?
Mm-hmm.
It is.
Okay. When it had your prior services in there, is that because of a medical feed is coming in, or it's because you've used Grand Rounds to seek those services in the past?
No, you don't have to have used Grand Rounds, although you could be coming back for another visit. In that case, we look at the claims feed, we see the diagnostic codes associated with those conditions, and we're just giving you an option to not have you fill out another form, right? We all go to the doctor's office, we fill out the same crap over and over again on that clipboard. This is just making it easier. You notice at the bottom it said none of these, so I could have registered a totally different condition at that point.
So we do send a full claim feed,
Yeah.
and pharmacy as well.
Okay. And then a quick question for you about getting rid of out of network when a lot of companies are going like full replacement HSA with out of network, and you've kind of gone to like the EPO HMO model.
Yeah.
Was there a lot of noise? I know you said you gave them a year, but did you get a lot of
No, we
feedback?
didn't. We didn't because I think because we really communicate it well, and I think it's also it aligns with our business philosophy in the sense that, at Costco there's only about 4,000 items in a Costco warehouse. You would think there would be a lot more than that, but you don't have a choice of 5 coffee makers. We find the best one or the best value. Maybe a high-low, one with bells and whistles, one maybe not. So I think our folks understand that, and they that it's confusing to have too many choices.
May I just say one quick thing about the noise point, just from our vantage point? So they did an amazing job communicating it. One of the things they did was all the people who were using out-of-network services, they gave kind of progressive communications to say, we're going to make this change. And they offered the service there to say, don't worry, there's a great person within your network, we promise, just use it. And then our commitment to them was, we're going to show them the survey data. And the member satisfaction on that was incredibly high. Now, I would say one of the incredible pleasures about working with Costco for me and my team is that their people really like them. And so that process was made easier because I think that trust had been built over time. So it's not that easy for everybody, but they did a good job of it, and we were able to do that in conjunction.
Yes.
Hi, Owen. I may have missed this, but where do you get your quality data from? One of my pet peeves is if you offer multiple carriers, for example, their best quality docs are not the same docs.
Yeah.
And it drives me insane. So where's, maybe you said it, but I missed it. Where's your
No, I didn't say it, and we do entire presentations just on this topic because it is, I think, a very hot area inside of Grand Rounds and out. How do I say this quickly? So we were initially a kind of parametric algorithmic technology looking at about 14 billion claims data points, some from CMS, some from our commercial partners, and some that we purchased. We use a whole bunch of training data. We use a whole bunch of actual outcomes data from the medical records and the aftercare summaries that we collect on behalf of our patients. So there are about 42 different data sources that go into that stew. And then what we do algorithmically is we evaluate 3 things principally. One, is this person actually good at the condition? So if you remember from the demo, I searched migraines. Dr. Safdie, or whoever that guy was, would not show up probably for epilepsy because it turns out the people who are good at migraines are probably not good at epilepsy, but they're both called neurologists. And generally when you see lists, you see best neurologist, best orthopedist, whatever. So we determine expertise. We determine communication quality and member satisfaction, because expertise is only meaningful if the patient's going to stay with the doctor, and that becomes a problem, especially in the non-surgical specialties. And then the last thing we look at is clinical judgment, clinical expertise, and outcomes, which is the thing that most people talk about when they talk about physician quality, but is only as good as those other two things being right. So this is a really long topic, and I would be happy to talk to anybody about it. In terms of the other different networks have different perspectives on it. I think our perspective internally on that is it's very hard to be a carrier and have an objective point of view about quality, because you have to go and contract your network based on availability and rates. Grand Rounds has a very strong philosophic perspective that hopefully has come through, that we really start the conversation with quality, and we're not contracting with these facilities. So we're not establishing a rate payment. We're just looking at, is it a good match for the patient? Has that person demonstrated high quality? Do we predict that they're going to have high quality with the next person we send them? So but it's a very long topic, and I'd be happy to take it up with the offline.
One of the other things that they do, or the reporting that we've seen that was fascinating to me, is it doesn't always mean we're going to, on a case, we're not always going to save money. It could be that case is presented and it's like, oh, no, this treatment is way wrong. This is the route you need to go, and it might cost double, triple, quadruple the amount. So again, for us, it was not about it. It's never been about the money. It's about the quality, and thinking that if the quality's right, the trickle down is where savings
you won't get
will
services
be. Right.
You won't need.
Right.
Yeah. Totally right.
Hi, thanks. It's not okay. I thought it was a great presentation, so thank you for that. And I guess my question is two-part. Number one is, do you find that there is capacity within these high-quality physicians in those areas? Is my first question. And then my second question is, long-term, if we were all kind of using the Grand Rounds philosophy, and all of our employees and their dependents were using those doctors, how are they able to, from a capacity standpoint, right? How are they able to?
We were in the early beginning, so we're always going to get preferential treatment. Just saying. Right?
That's true. So I have to just say, I love the question, because that's what we call back in the home base a good problem to have, because that would mean that, generally speaking, people are taking the quality question a lot more seriously. Here's my perspective on it. There have been a lot of headlines about doctor shortages in the United States. With 770,000 practicing doctors in the United States, we have a higher per capita rate of physicians than anywhere else in the world by almost 5x. We have more than enough doctors in this United States. We're not using them appropriately. That's the general capacity equation. Then there's the targeted capacity question. So among the people who we would recommend, how well are we using them? And there, what I would say is, I think it is possible at some future point where we represent a higher percentage of the patients, a very high percentage even, of the patients that any one doctor would see. But an interesting thing is going to happen there, where a lot of the doctors right now, if you're a general surgeon who is expert in pancreatic cancer surgery, you should be seeing pancreatic cancer cases. You've also been trained to do hernias, but hernias can be done by a lot of different kinds of surgeons. And so we shouldn't be filling your patient panel with hernia surgeries when you are, in fact, a pancreatic cancer expert. Most of our doctors, the doctors who are on our medical advisory board, wish for that day. From their perspective, they have no control upstream on who comes to their clinic, or very little control. It's just as good as the referral coming in. So it's a good question. We haven't experienced it yet. I think in the future, it's just going to be a better sorting mechanism for the doctors who can treat certain things.
Donna, you talked about how they actually make the appointment for the individual, and you talked about the fact that it's pretty quick. How does that happen? Do they have, priority with the doctor, or how do they get in? Instead of you got to wait 3 months to go see a specialist. How does that work?
Okay, so
they just make it happen.
Yeah. My cousins Rocco and Vito. No. So we don't always get the patient in quickly, and I want to be really clear about that. Generally, we can. When she talked about quick, it means the appointment setting happens quickly. You may be seeing the doctor in a month or even 6 weeks. If we think they're, if you are, I remember this case because it was such so seared in my memory. If you are, pregnant with bipolar disorder and there's a medical complication in the pregnancy and you have to stay on your psychiatric meds, there aren't going to be a lot of doctors in your community who can treat that, and waiting to get to the right doctor is absolutely critical because that is 2 people's lives that you're affecting at that point. Most of the time, though, we're booking an appointment within 7 to 10 days, and there we develop a reputation within the communities we serve. I think it's a good reputation. We have a bunch of professionals back in headquarters who just do this work. And again, to the gentleman's question, we're sending them cases that are interesting to them. So we're not sending cases that are really off the mark of things that they don't want to treat, that they don't have time for. But it's a terrific question, and honestly, we have to have that conversation directly with the member so that they understand that trade-off in time versus quality. Also, distance is really important. So if you're in a rural area, we do our absolute best to get you seen in that rural area. But you know what? If you're dealing with something really hard, we have to have a conversation about driving 50 or 100 miles because that could be the right choice.
But that's the thing that's so cool is that there's a lot of counsel going on to say, this is the case that you're presenting to us, and really, we're giving you just such great a path that you need to set the expectations.
Yeah. Treat them individually.
Danielle up here has been waiting patiently.
I just had a question about the medical records collection and how you actually go about that, and if you're confident that you're getting the full picture. So if it's a subjective that the patient is giving you who they've seen, what tests they may have had, are you certain you're getting a comprehensive look, or maybe are you using claims to get at that, or how do you do that?
Marvelous question. So this is one of the early roles that staff physician who we talked about plays. Most of us have seen many doctors. On average, the average American changes doctor every 18 months. That's shocking, but it's actually true. And so there are going to be a lot of records out there, and some of which you may know about, some you won't. The first thing we do, and we do this with Costco, is when you sign up, just the same way it showed conditions that I might be interested in, like my migraines, we actually suggest, hey, are you looking at, you're going to sign a medical records release online. You sign it with your finger so you don't have to print anything out and fax it. And we're going to suggest, hey, here are the doctors you've seen. We're going to go see if these people have records relevant. Does that sound good? You can also enter another doctor's name right there. Oftentimes when we get a first batch of records, the record specialist will look inside of it. They'll see indications that there was a radiology report. And we don't have that radiology report, but one of the physicians mentions it. We go out, we find that radiology report on behalf of the member. What we don't do, because I don't think it would be a good use of anybody's time, is go back 15 years. You're dealing with migraines, right? We're not going to go back 15 years to relook at your tennis elbow that you had when you were playing in college, right? But that's the physician's call. That's not my call. That's that part does not happen automatically. That sort of sorting of priority. But it's a really good question.
Yes, in terms of the display of information, could somebody use your tool to look up any type of doctor? Is it only for select conditions, or if I just needed a pediatrician, a good pediatrician, are you doing that across the board? That's sort of the first side of the question. And secondly, if you're doing that, could this be used as a replacement for some of the health plan directory and transparency tools out there?
I did not ask her to ask that question. But yes, on both. And actually, pediatricians is a really interesting example. So we find everything. Anything that your plan would cover is something we are going to qualitatively and quantitatively assess. So you can find any of those things. And in a case like pediatrics, we actually overweight on things like communication skills. Remember I talked about the 3 components of the algorithm? In the case of pediatrics, you're really looking for somebody who can have a relationship not just with the child, but frankly more so with the parent. And I know this because I have 3 children. And so we absolutely do that. I think in terms of, we're not out to replace anybody with anything, but we're out to be a better way to find the physician that's right for you. And I think what we're going to rely on, frankly, all of you to tell us is where does that fit? We know that this is required because every time we talk to our members, this is the problem they want to solve. They, it's like, they get their recommendations from Facebook, they get their recommendations from FancyDoctors.com. I mean, they're getting it from places that are underinformed. So I do think that's going to matter, and we are going to probably use things like cost over time to help further sort as a sort criteria if people want to look at it, but we're not introducing that right now.
Do you do patient advocacy after the appointment? So if somebody, I know you get a 17-page report or whatever,
Yeah.
they say, we're still not sure what the doctor's talking about, or we need more help with this. Do you all do the advocacy at that point? Or
Yeah. So the question was, for people who didn't hear it, was what's the ongoing advocacy model? So do we support? And the answer is 100% of the time. And by the way, I've listened in on these calls, and I'm amazed at how many people feel embarrassed to say, I wasn't handed a piece of paper. I didn't know what he was talking about. He seemed so busy. He ran out of the room. I couldn't ask him. I mean, there have been studies that have shown that 75% of cancer patients, newly diagnosed cancer patients, cannot remember after their first appointment what the name of the cancer was they were diagnosed with. And so that all comes back to us in the medical record, and the staff physician will talk you through both kind of what was observed and then what treatment options were discussed. And then it goes on, they can read it if they want. I mean, it's in the permanent record.
The permanent record.
Well, sorry, the medical record for
your permanent record.
Yeah, that has a bad connotation. It's going on file. But I mean, it's in the, it's in your mobile app under your medical record step.
We're at time. I don't want to get anybody. Okay.
Thank you.